now, mysterious cases of severe hepatitis in children have now been identified for the first time here in Massachusetts. Here to answer your questions about that and a lot more, Dr. Simone Wilds, an infectious disease specialist at South Shore Health. Thank you for being with us, Doctor.
Hey there, Dr. Wilds. Great to see you. So let's start with that. Let's start with what we know. 2 local patients diagnosed with hepatitis. Both are younger than 10 years old. Neither infection has a known cause. So why is the CDC now investigating?
Ed, I think I just want to remind everyone that the CDC really is doing their job, right? They need to investigate whenever there's an outbreak, and in this case, hepatitis in children. Definitely they have to go ahead and investigate it. Remember, it's a very rare condition, and we don't know much about it. So the CDC has to try to figure out what the cause is, how we should manage it, how we should treat it, and most importantly, how can we prevent this from happening to other children.
So just to narrow it down, even one case would trigger an investigation, right? It seems to be a small number, but even one case would trigger the investigation,
Good
right?
question.
Yes, it's just very rare and something that we don't see in children that it would trigger an investigation. Correct.
Doctor, the Mass Department of Public Health mentioned that both of these patients tested negative for adenovirus. Why is that important?
Maria, when this was first brought to everyone's attention, the cases in Alabama, they found that adenovirus was a common link in that case, which is what prompted the CDC to start the investigation. Here in Massachusetts, the 2 cases are negative for adenovirus. I think it really goes to the point that there needs to be a lot more work to figure out what is really causing this so that we can help the children.
Doctor, you can understand why some parents, they hear the word virus, they immediately run to COVID-19. So do you think there's a link between these hepatitis cases and either COVID or the vaccine?
Ed, great question. I can tell you based on the data that we've had for the past 2 years, there has not been any link of hepatitis due to COVID or to the vaccine. But I'll tell you, we'll definitely keep monitoring that closely. But right now, no links.
The cases are rare, and we keep saying that. But what should parents know about possible early symptoms, Doctor?
Maria, I just want to really reassure the parents that it is very rare. As a parent myself, I'm concerned, but I think we still need to be informed about what we should look for. Initially, we can have what's called non-specific signs and symptoms, where you can get this in any illness. That could be like fevers, body aches, you could have GI symptoms. However, if you start having scenarios where your urine is really dark, you have light colored stools, if your skin starts to get yellow or your eyes, we call that jaundice, I think you need to contact your health provider so that they can take a look.
Dr. Wilds, thank you. It's always great to see you. Thanks for your time.
Thanks, Doctor. Stay well.